What's up, y'all? It's Bomani Armand once again with the Black Coffee Channel. We're doing our Man on the Street interviews again. Today we are talking about universal health care. That's one of the biggest things the politicians are talking about running for elected office right now. So what do you think? Should the government be in charge of making sure everyone has free and equitable health care? Let's see what people have to say about it.
Universal health care is definitely the way to go. It's a system that works well, has worked well in other countries across the world. The United States needs to step up and make sure that every American is insured and that people are covered. It's very scary when you do not have health benefits, when your health is at risk or your family and you cannot tend or take care of them. And those bills and coverage can really take you under. So it's very important that we look after our people of all social and ethnic backgrounds across the country, and that they are insured and taken care of in the time of need. So many people give so much to this country and are taxed beyond measure on little things. But when you look at something as big and as major as health, it's very crucial that they are covered and taken care of. Thank you.
Is universal healthcare the way to go? I used to be a financial underwriter for a healthcare company called Coventry Healthcare back in 2001, and I think that universal healthcare is the way to go because, people get sick, people need to be able to go to the doctor, and a lot of times people don't go to the doctor because they're afraid of how much it's going to cost. So we don't take our health concerns as serious as they should be because we're more concerned about the bottom line, and that's not what I think that medical concerns or sicknesses should be about. It should not be about being scared to spend $5,000. If you're sick, you should be able to just go to the doctor. I think we're the only industrialized nation in the world that doesn't have some type of universal health care program. Great Britain has it and they're fine. France has it and they're fine. And Medicaid in this country actually works for the elderly and for people who are poor. So there's no reason why Medicaid and a government controlled program can't go across the lines for everyone that's a citizen in America.
All right, we seem to have a consensus on this one. Most of the people we're talking to seems that the government should have some kind of role in making sure everyone has health care. Let's see if we can find some other opinions on the matter.
I guess I've been asked to give a response in terms of whether or not universal health care is something that's beneficial to our culture and to our society. I actually am a resident physician working in family medicine with a background as a medical degree from the University of Pittsburgh and a master's degree in public health from the University of Pittsburgh as well. And I guess that's the bend in which I'm coming from in terms of addressing the issue of universal health care. I think that most Americans feel that health care isn't a privilege, it's actually a right. Much as in the way it would be that we have a right to police departments and fire departments, and all those things are public services that every American deserves to have. The challenge is that healthcare and its administration has costs. In a perfect world, I do think that every American deserves to have healthcare, and not just the bare minimums, but the highest quality of care. The challenge, though, is that we live in a capitalistic society in which there's always going to be a division of haves and have-nots, and it's trying to rectify that difference between the haves and the have-nots in the administration of healthcare. The challenges are that, there's two political candidates, Hillary Clinton and Barack Obama, who both believe that every American needs to deserve to have a right to have health care. The question is that, what is it that each individual is responsible for in terms of that care? Are we mandating that every individual pay for health care and that they have to buy into some sort of universalized care or generalized health plan? Or are we going to give individuals the right to decide whether or not they want to have health care and therefore, have some type of coverage? At the end of the day, I think that we need to think about what's going to be beneficial, for the whole. All kids obviously deserve rights to have health care. All Americans deserve to have rights to have health care. I think that our challenge, though, is finding a fair, equitable, and cost-efficient way of trying to deliver that care.
Is universal health care the way to go, or is it the best option for us? I'm not confident that universal health care is the answer to our health care woes. I think that when you talk about the problem or challenge with regard to access to health care, the real question is the high cost. And I'm not so sure that providing universal health care coverage that is paid for by the government is going to cure all of the ills in the system. There's a lot of inefficiencies in the health care providing system right now. So I'm not I'm not certain what the answer is, and I think there are a lot of smart people who are much smarter than I am, who've been tackling this question for years now. But I'm not confident that the government providing health care for everyone is the correct answer.
I think universal health care is the way to go. All Michael Moore documentaries aside, I've always felt this way just because I'm a college student, I'm graduating next year, and I have to think about, in terms of getting a job, not just getting paid enough to survive, but getting paid enough to be healthy and live if there's medical benefits, if there's not. I don't feel that we should live in a country where some people can get sick and actually die because they can't afford to get help. I know other countries have universal health care. I know for myself, I don't think that should be an issue. Everyone deserves universal health care, and I know it's a worry for me in terms of looking for a job, finding employment.
Is universal health care the way to go? I believe yes. I come from a complicated situation back in high school. My father actually passed away. I moved in with my sister, and it was a big ordeal to either get on her health plan or her husband's health plan, which is the only way that, as a minor, that I could get health care. And then graduating from college, being over the age of 18, I didn't have a full-time job with benefits. I had a lot of trouble getting health care. And what actually happened was my brother finagled the system, I don't know how, but he swindled it such that I was on his health care plan, which is against the rules, obviously. And there was a mistake made. The company found out, and they had to kick me off his health care plan. Now, since graduated from college, I am actually an independent contractor. And of course, as an independent contractor, I do not get benefits. So I'm still in the same situation I was in when I was 18, when I was 20, when I was 23. I do not have health care benefits. And I think paying for my own health care would be rather risky. I'm just not willing to invest that type of money into a system that I'm barely going to use. I'm hardly ever sick, but it would feel nice to have that security that if I do get sick, that I don't have to pay out the wazoo just to have a doctor tell me I have strep throat or what have you. So yes, universal health care is the way to go.
All right, y'all. Once again, it's Bomani Ahmad about to sign off with the Black Coffee Channel. We were talking about universal health care today. There seems to be consensus. The government needs to do something about it. So let's see if these politicians are really going to do something, or if they're just all talk. I'll see y'all next time with the Man on the Street interviews. Peace.